Well, thanks so much for joining Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. We're talking about our interview with Dr. Graham Gardner, who is the co-founder and CEO of Kyruus. And I loved this interview because it's so many. We always find that, the touchy feeling, the heartstring type of things are the things that matter. And even though Kyruus is a digital health company that's focused on booking and scheduling and has now developed all these other partnerships to better serve patients from beginning to end, they are so patient focused, very much on equity. And it was interesting hearing about some of the things that they've found through their own software and data that people, they go on there and they search. They can go on Google or can go through their healthcare system, find a doctor type of portal, and they can enter different terms or symptoms that can then get them to the correct provider, which is something that's really valuable because I know personally there are times where you're not sure who to go to. You need to have something, but a couple different people might fit. And so you might go see somebody who's not the right person and you kind of bounce around until you finally get it. So I love that their software allows people to put in symptoms and then help route them to the proper provider, and then the providers that are interested in treating those types of things as well. But then one of the things that they found as a sort of a side development was that the search terms that people are putting in on the portal and in some of the search engines are very different. And so he mentioned transgender populations a number of times, people who were looking for transgender care or surgery. They were searching different things in the search engines, but then they were able to, help facilitate that and help them start that journey into the care. So he said a couple of times, we want to meet people where they are. And in my head, when he spoke, it was very clear that it wasn't just meet them where they are literally for that search to start looking for help for a condition, but it was also in other ways, even if originally unintended, they realized it was meeting people where they are for a bigger life journey. And so it was really cool because, again, it's a digital health company focused on, all the data and the technical things, but it has so many of these human components around access and equality. And I thought that was amazing. Apoorv, what stood out to you?
Yeah, I guess I'll jump off right where you are, Stephanie, the human component, which is kind of interesting because Graham actually went to Brown Medical School like I did, and in the 8-year medical program. And that's actually a particular feature of Brown, which we're all really proud of, is that they really focus on that human element. So it's interesting that you picked up on it, and that it's clearly evident to us, right, that when we speak to him, and our audience, I'm sure, will appreciate that he really is so patient focused. Yeah, he's building a technology company and it's got all these tools, and it's pretty complicated and all databases and such. So we can get really technical, but really what he's about is trying to ensure that his patients, the patients that he knows that struggle in the real world with being able to get access and getting the consumer seamless experience that they would like, how do we ensure that they get that? So I really appreciate how he's been able to take all of his years of medical training, and focus in on that human element. Even though we learned anatomy and physiology and pathology, ultimately we all joke that when you're finally into practice, what you really need is that sometimes, many times, that connection with the patients, the trust and the hope and reassuring patients. So if they can build that into the way in which they deliver their technology, it would be amazing. The one aspect that he talked about, such as when they're creating this robust profile of their doctors and allowing them to figure out whether they want to be able to serve homeless patients. Maybe that's the kind of way in which not only are you enabling more humanistic and more equitable access to care, but you can imagine if certainly all these variables that people struggle with, that we struggle with in society, are now made more available to health systems and made more available to physicians, so that they can make a more proactive choice and take a role in expanding, access to these vulnerable populations. That could actually be, really profound. So not only enabling, it could then become very empowering. So he certainly seems to be the kind of guy that has that kind of vision and gumption. And I'm hoping that he's going to be able to figure out how do you stitch together all this technology in a way that actually delivers that. It's really very exciting.
Absolutely. It was fascinating to hear. I hope that if you haven't watched the full interview yet, you go back and watch that because it really is a great one. And we'll talk to you all soon. Bye bye.
Bye bye.